another location where I have. Give me 1 minute.
Oh dear.
Maybe if you have the line over telephone, Lisa.
Yes, let me.
Yeah,
I'm going to relocate.
it's okay.
Okay. It's interesting experience.
Most
For
respected.
sure.
The solution is in the problem, right?
Yeah.
Exactly.
Kishore sir. Sir, Kishore sir, we could start.
Please stop.
Most respected guest of honor, Honorable Shekhar Dutt sir, who was the governor of the Indian state of Chhattisgarh. Early he had served on various bureaucratic posts, including as an IAS officer, as a secretary to the Ministry of Defense of the Government of India. Currently, he is the advisory of Sea and Coast monthly maritime magazine based in Delhi. That sir belongs to the 1969 batch of IAS from Madhya Pradesh cadre. Sir became a short service commission officer in the Indian Army and was awarded the Sena Medal for gallantry during the Indo-Pakistani War of 1971. He had held various posts in Madhya Pradesh government, including Principal Secretary to the Department of Tribal and Scheduled Caste Welfare and Principal Secretary, Department of School Education, Sports and Youth Welfare. Sir was appointed as Secretary of the Department of Ayurveda, Yoga, Naturopathy, Unani, Siddha and Homeopathy in the Ministry of Health and Family Welfare of India. As Director General of the Sports Authority of India, Sir played a role in hosting of the Afro-Asian Games in Hyderabad in November 2003. Sir eventually became the Joint Secretary in the Department of Defense Production and later took as Defense Secretary of India in 2005. In 2007, Sir retired as Defense Secretary and was appointed as Deputy National Security Advisor for a 2-year term. In 2009, Sir was named to the Board of Trustees of DeSales University. On 23rd January 2010, Sir assumed the office of Governor of Chhattisgarh, the post to which he served till his resignation in 2014. Sir was awarded by the Wales United Kingdom honorary degree and Fellow Swansea University 2018. Sir, on behalf of the Ministry of Youth Affairs and Sports, Government of India, Hello India, Lakshmi National College of Physical Education, a warm welcome to our honorable guest.
Thank you.
And a former Director General of Sports Authority of India. A warm welcome to you, sir, for this PE program.
Thank you.
I also would like to welcome our distinguished speaker, Luisa Velez. She earned a PhD from Texas Women's University College of Health Sciences. Her contributions to the field include several research publications and book chapters in the areas of international sport, sport consumption, social issues in sport, and health. Furthermore, Dr. Velez has served the field of physical activity and sport by joining the board of various organizations or associations. Recently, Dr. Velez joined the faculty of Universidad Sagrado Corazon, Exercise Science Department, San Juan, Puerto Rico. A warm welcome on behalf of the Ministry of Youth Affairs and Sports, Government of India, Hello India, warm welcome to Luisa Velez. I also would like to welcome Dr. Melissa Gonzalez-Lamourt, who earned a master's degree in exercise physiology from Long Island University, New York, USA. Since 1995, she has served in the Department of Sports and Recreation of Puerto Rico as Physical Aptitude Educational Coordinator. Professor Gonzalez is also a track judge referee and specializes in therapeutic massage. Gonzalez-Lamourt is a faculty of Universidad Sagrado Corazon. Once again, on behalf of the Ministry of Youth Affairs and Sports, Government of India, Hello India, and Sports Authority of India, a warm welcome to you, Melissa. I also would like to welcome Professor Rosa D. Amico, who is the president of IPASCOE, a warm welcome to you. I also would like to welcome Darlene Kluka, who is the vice president of IXP. Welcome to you. I also like to welcome Beatrice Ferreira from Brazil. And I also would like to welcome our principal, Dr. G. Kishore sir, to this particular function, Dr. Sanjay Prajapati, and my all PE teachers from across the country, a warm welcome to you. Over to you, Kishore sir, sir, for a brief address.
Thank you, Dr. Usha. Most respected guest of honor who has agreed to be our guest panelist, Sri Shekhar Dutt, SM, former Governor of Chhattisgarh, Deputy NSA, Defense Secretary, and DG-SAI. Our respected both resource persons who are taking today's session, Dr. Luisa Velez and Prof.Lamourt, other distinguished panelists all across the world, all participants, ladies and gentlemen. It's a very important topic we are coming today on a sedentary community, the chain reaction of COVID-19 and lack of physical activity in personal, family, and community health. One of the most relevant and theme which could be discussed in any forum at present. The impact of participating in sports and physical exercise is paramount importance at this point of time. And I think the physical education teachers who are present need to be appraised and their skills need to be honed in order to tackle, as rightly pointed out by our guest of honor, Shekhar Dutt sir, that this is not going to, the scenario is not going to have a change in the near future. So the only possibility is how to contain this pandemic and how to sail against honing yourself and getting immune and with all required skills by physical education teachers and coaches. So this is the session which is going to be taken by these internationally renowned experts, will definitely throw light on and will equip our physical education teachers and community coaches on required inputs and which need to be taken into account and kept in mind to tackle this menace, and also to make our society, our family, and your own personal life comfortable and help away from possible consequences which can affect out of this. More than physical health, the mental health is also another factor which is going drastically weaker. I think the session will also throw the light into how exactly your mental and physical health need to be kept in a positive way, and what are the measures and actions to be taken in this direction, and the role need to be played by the physical education teachers and community. The presence of respected Shekhar Dutt sir will further be of more advantageous, because sir, despite having adorned many coveted posts, had always been having contained a lot of passion and shown towards development of sports. I remember that it is during the time of Shekhar Dutt sir as DG-SAI, the sports science division of SAI was strengthened and taken into new heights. I think the whatsoever actions taken by Shekhar Dutt sir as DG-SAI in strengthening sports science is giving its dividends even now. And sir is having a lot of knowledge about sports science, has got a lot of experience too, and the remarks made by Shekhar Dutt sir also will be definitely contribute towards the success of today's session. And I personally take place on record our sincere gratitude to respected Shekhar Dutt sir for having spared valuable time despite his busy commitments. And sir is having another commitment, another webinar at 6 p.m. so have to leave early. So, but agreed to be with us from 5 p.m. to 6 p.m. So thank you so much, and so kind of you, sir. And also I welcome all the two very distinguished and eminent resource persons, both Dr. Luisa and Professor Lamourt, for their valuable presence and your agreeing to come on and to share your expertise. Thank you so much. And I also appreciate the presence of all the other distinguished experts, Dr. Rosa, Professor Darlene, Professor Beatrice, and my colleagues, Dr. Usha, Dr. Sanjay, and everyone. I wish this session all the very best, and I'm sure that this is going to throw light and make the DP community of the country more resourceful and efficient. Thank you so much. Over to them.
Thank you, Kishore sir. Shekhar Dutt sir, for your address, sir. All are eagerly waiting for this.
Thank you very much. Good evening, ladies and gentlemen, and maybe good morning to some. And so anyway, we are all together because of a very peculiar challenge in the, namely the COVID-19. And I think it is very timely. Dr. Kishore has designed this program because it's very timely that the intrepid human beings cannot be daunted by a pandemic or a virus. So the virus may remain, but we have to be one up on the virus. And that's what the sportsmen or sports persons, sport girl, have always been trying, that they should be beating their own record. They should be making waves and making new horizons. So now COVID has restricted a lot of training, but I would say that it is necessary now that your organization and organization like yours and all the people who are here, very, very eminent sports scientists and physical education teachers, and very much of those people who are dealing with the subject, have been uh, making training aids, and these training aids has gone uh, from different heights to different heights, so much so that when I was a youth, mile under 4 minutes was not there. So Roger Bannister, I think he was the first person who did below 4 minutes mile. And now we are way ahead. 10 seconds is no longer the norm for any 100 meters winner. If the 100 meters winner or any person who doesn't have 9.7 seconds, he doesn't stand a chance. You take any sport, the participants have raised the bar and they have gone on to new heights and new heights. So much so that at 30 years ago or 20 years ago also, people did not have any idea that the records would be broken like this. Now, all this could be possible by good physical education right in the beginning, good training, good coaching, and good sports science backup, so that a good sports person talent can be spotted, and his ability can be increased. Now, let's see what are the methods by which we can beat the COVID. I think even if there are some schools or colleges where assembly of children or students is not allowed or not yet allowed, I think a similar long distance coaching program or training program, physical education program, individual, targeting the individual, should be done, and very elaborate recording of the achievement should be done, so that you can then concentrate on the areas where the person, whatever age group the person might be, how is he doing? Is his muscle being developed? Is his reflexes being made good? I raise stress on reflexes quite many places, because in any case, I had been in the army and I know how important it is for any person in the armed forces to have very good reflexes. Now, a sports person also does require very good reflexes, because the sports person should be able to judge the other person. What is he going to do? What way he is going to dodge you, and then prepare yourself. And if he dodges on another side, then he should be able to react fast. So all these are reflexes. So how do you train people to have good reflexes? Same way as you have other physical training. And therefore, training can be done on a very scientific manner from a long distance. And all the necessary documents can be made so that you know how a person has achieved so far by the training. Because at some point or the other, then you would require competition. And that also I am sure that we will be able to find. And before the today's event, I was talking about that we could have competition on a very selective way, even if the COVID pandemic is at the highest level. Even then, we could do a bit of a competition in a selective way, that instead of having 12 persons running in say 100 meters, you have 4 persons, and then another 4 persons, then another 4 persons, like that. And I think we have to do this in a very scientific manner: training, coaching, competition, training, coaching, competition, and continuously doing those kind of things. We also should find, and I think Dr. Nair and her team would be able to do that. We also should find new methods of training and then document it. This would be, in any case, very helpful, even if there is no COVID. Because we'll be able to, the school will be able to, the coaches will be able to handle trainees at a longer distance and for all times. So there is a very good possibility of conducting training by drawing up a training regime. But I think documentation should be done. And many of the persons whom I see who have been doing a lot of research in all this, I think would be very useful in drawing up those manuals for new mode of training. This is a time that that we can concentrate on those kind of making actual training, and then drawing up those new documents for training and making manuals. Then competition. I think it is absolutely essential that we should go for new methods of competition. And how we can do that, I think I'll have to leave to others to discuss. Every type of sport would have different method of competition. There are some sports which are not physically required to have physical contacts. It is easier, but even those where you require physical contact, you can do it, provided say for example, if the entire team is tested and doesn't have any COVID symptoms or the infection, then you could have two teams doing it. You could have competition and similar things, which can be or should be tried with the participation of doctors, epidemiologists, and others. So human beings have to come up. I mean, one little virus should not be able to dominate the entire mankind and affect the most important section of the population, and that is the youth. That is the from the child to the youth. That's the most important. There are future leaders. There are future persons who will carry the world forward. We cannot have them permanently disabled by this kind of a pandemic situation. Another sector which will require attention is also the all the other allied discipline. Say, for example, the for competition, how do you have umpiring done? How do the referees have to? What are the methods by which you can have 5 different places from which this kind of training, this kind of competition would be done, and I think we those elements also would require to be seen, and new guidelines should be made. And so therefore, after all, sports has been a sector which there have been changes for the good. I think we can still make some changes, and we can have competition done. Another thing, of course, is this electronic. I mean, electronic mode, thank goodness, is there, and we have to master it. We have to master it, and perhaps the coach can be at one place, the sports scientist can be, with all the data, can be at another place, but the place where the person or the youth will do training should be such where he can be monitored by video and cameras properly placed. So if that is possible, then a lot of physical contact can be avoided, but you can still have this. Now, why should sports get this kind of special attention? I think it is absolutely necessary, as I have been saying everywhere, that sports for youth provides them with huge amount of training. It is not necessarily just that he is being trained for getting an Olympic medal, but he is also getting trained for becoming a good manager. He is also getting trained for becoming a good leader. So individual games where individual person tries and beats his own record, he beats the regional record, the national record, the world record, is all because of his continuous attempts. Now, a person like him would be a huge good possibility of a good leader, because that's what a leader has to do. He has to do everything what he expects the others to do. So sports is an extremely important human development tool. And I think all those who are handling sports and sports science, physical education, the competition of sports and management of sports, I think all of them should emphasize that sports for the youth, for the child or children, is extremely important modicum or method of growth, and therefore attention should be, special attention requires to be given. If we don't have sports, then the it will be a huge disadvantage to the youth of that country, of that region, of that town or village. It will be a huge disadvantage, and therefore we should enable everybody to find new methods of training and then competition, and also continuously raise the bar and be available or be able to become a better human being by excelling on sports, and the training received by in sports will make the person a much better say individual who will be able to lead anything. So with that, I thank everybody who's given me this opportunity, and also congratulate Dr. Kishore for choosing this topic. And I think it's very important. The local education department must also get into involved in this thing. Youth affairs department should get into this, and everybody should have an interest to see how in these difficult times the youth of any society keeps on going ahead undaunted and becoming a better citizen, becoming a better person. Thank you very much. All the very best, and be successful in everything that you are doing. Thank you. All the best.
Thank you so much, sir, for your valuable suggestions and guidance. And I'm sure we'll take note of all these and try implementing it. So on behalf of the Ministry of Youth Affairs and Sports, Government of India, a very big thank you.
Thank you.
For sparing your valuable time and being with us and interacting with our international speakers. Thank you so much.
Thank you.
So could we start a session, sir?
Yes, please.
Madam Luisa, for your session, please.
Yes, good morning. Oh no, good evening to you all.
Yeah.
Is the presentation visible?
Yes, it's audible. You're audible and we can see you.
Great. All right. Well, good evening to everyone. My name is Luisa Velez, and my co-presenter, Melissa Gonzalez-Lamourt. And in line with our guest, we will be talking about what is going on right now globally with COVID-19 and how it is affecting not just us personally and our social systems, our educational system, but also it's affecting our family and our community health. Now, I have taken time to read some of your questions, and we will be answering these questions throughout our presentation. Let me go here. All right, so the focus of our presentation, first of all, is what is the new normal? So our lives, such as Dr. Shakar has explained to us, has changed drastically. Our way of conducting business, our social life, our interactions have changed. And this has impacted us individually and as a society. And exercise science professionals, whether you are physical education teachers, whether you are coaches, whether you are physical activity leaders, or whether you are in positions of power and have the influence to change the narrative, this is our time. Right now we're looking at nurses and medical doctors, but physical activity leaders, physical education professional, exercise science professionals, guys, this is our time to prevent. Now remember, health is all about prevention. So we need to take a role. We're going to talk about the importance of us taking a role and be at the forefront of the narrative and be at the forefront of leading us through our new normal and leading us through practices that will help us be better equipped to navigate this new normal of COVID-19. All right, so during the past 5 months, at least in the US and in Puerto Rico, this date will fluctuate depending on globally where you are. But life as we know it changed, right? Social distancing is required. We teach our children to shake hands, we teach our children to hug, and now that is not allowed anymore. Social distancing, keep your distance, cover so that you can protect yourselves. Some countries have even enforced quarantine. In Puerto Rico, we were put on what we call lockdown or quarantine, to where you could not leave your house unless it was to pick up medicine at a pharmacy, buy food, or go to a hospital. Everything else had to be done at home. Our exercise centers have been closed for a while, and then they were restricted as to how many people can have access. And like you all, we are close to the ocean. Well, even our beaches and our recreational spaces were limited. And the time that children had to move and exercise was also shut down. Now, it's important that we remember that children learn by playing. So essentially, in these young ages, we took away the environment where children thrive, the environment where children learn. They see, they imitate, they practice. This is where we influence our children's habits. Well, that all was limited, and we were told to stay home, and everything went online. While this happened, while we were all told to stay home to keep us safe, these are the statistics that also started to occur. There was an increase in drug overdose, from 40 to 50% increase. And it is understood that these overdoses were attributed to the unemployment factor. So we have our fellow citizens who are no longer, or who are struggling to make ends meet, who are struggling to put food on their table, who are struggling to provide for their family. The isolation factor, when we talk about isolation, is the disconnect from our environment, the disconnect from our social circle. Isolation factor affected anxiety, and it affected depression. So there was a surge in terms of mental health. And we know that there is a direct relationship between exercise and mental health, but our prevention factor, which is exercise, physical activity, was brought down, and stress factors and isolation factors rose. The National Center for Mental Health reported an increase. Typically, they receive 60 to 80 calls per month of people who are struggling with anxiety, struggling with negative thoughts. During this time of quarantine, those calls rose from 60 to 80 to 300 to 400 calls of people calling, asking for help. 1 in 4 young adults consider suicide due to the stressors brought upon by the pandemic, and an increase in reported child abuse cases. I have a medical doctor friend who works at a hospital, a major hospital in the state of Texas, USA, and she shared with me that typically they have 5 cases of severe child abuse in the hospital, 5 cases per month. And ever since the quarantine, they were having 5 cases per day. And I want to remind you that these are reported cases. not cases that go unreported. So really, we have a situation that is alarming socially, personally, and in the home, we have a situation that is alarming. Now, what are health aspects involved? And I'm going to pass it on now to my colleague, Melissa.
Hi, everybody. Thanks to having me. My name is Melissa, like says Luisa. The most common health problems have changed in the 20th century, and infections were the biggest cause of disease at the turn of the century. But right now, we are kind of over there right now because we don't have the vaccine for COVID-19. There is some investigations that these vaccines are come out at the end of December, and maybe two others, the 2021 and 2022. So they are in phase 3. So let's see how everything goes. So the biggest health problems today are related to hypokinetic and chronic disease. Hypokinetics, it's because we are more sedentary, we are more standing still, we are not moving. So disease that develop due to lack of movement. So long-term disease prevention has become the best medicine. So that's why we are here. So the risk factors that most negatively affect health today are sedentary lifestyles, poor nutrition, stress, and environmental factors. From sedentary lifestyles, movement and physical activity are essential to good health. And we're gonna see that what we want and we want to promote is that people move more. Maybe we're gonna see a difference between what is exercise and what is activity, keep on moving. So what's going on? 38 million deaths from chronic disease worldwide. 65% of deaths are related to cardiovascular disease. 80% of these deaths can be prevented with healthy lifestyles. So that includes COVID-19. And if you see, there is a chance that 80% we can prevent, and that is by being active. So physically active leads to longer, better quality of life. So here is where is the difference between exercise and physical activity. And I want to make sure that everybody put it together, because exercise involves planning, structure, and repetition. Results can be evaluated looking to improve health-related components. But right now in our situation, we may be not gonna be able to do exercise per se. So what we need to do is physical activity. And this is the body movement produce muscles that require energy expenditures and produce health benefit. So this is the movement that we need to promote. So wellness, it is defined as the constant and deliberated effort to stay healthy. It requires implementing positive programs to change attitudes and behavior. And maybe this is where it's a little bit challenged because of the attitudes. So the biggest problem is behavior modification. The biggest treatment to well-being is lifestyle. How is the lifestyle of our country? How we can manage? So here is different dimensions that we need to look forward to have a better quality of life. And here the dimensions are education. How is the education nowadays? And we know that schools are closed. So how really we are getting into our kids, how really we are getting into our youth so they can get there into education. And not everybody have access to platforms as Zoom or Microsoft. So you need to analyze how your country are gonna get to these people that are in disadvantage. Maybe they can have TV programs. Maybe they can have radio programs that can communicate with persons that don't have access to internet. So what I'm saying is that maybe you can have a little bit programs like a boost of 10 minutes of physical activity in every day about, around the radio, about TV stations. So even social, how is everything working around you, environmental, emotional, how your people are feeling and what they are doing in occupation. We know also we need to put in here the economy, how economy is working, because that can really affect people. We know that in some countries, maybe because of the economy, it's low, they can put their kids to work. They can put kids to do other things and not really have education in their life. So you need to analyze and see how you can work in all these dimensions so people in your country can have quality of life and put it together. So wellness incorporates the following aspects. We have fitness, proper nutrition, stress management, disease prevention, health education, regular physical exam, substance use control, cessation of smoking, and personal safety. So all these have to integrate to have a wellness. So here's the difference between physical fitness. We have ones that are health related, and there's ones that related to motor skills. Right now, we need to focus on health related. We need to focus on our cardiovascular resistance. We need to focus to muscle resistance, strength, flexibility, and nutrition. Nutrition, usually, if we are at home, we don't eat the good food, we tend to eat even more. So there is a problem and we can get some weight control. So we need that weight control. So the related motor skills, that's a part. We don't really need to be focusing on that. When children play, they get all those. So we need to keep on having them have fun, to move, to play, so they can have the health. So the general guidelines for cardiovascular training, it's FIT. If you see FIT is for frequency, intensity, time, type, and there we have an E from enjoyment. So frequency, we want every day of the week for small amounts of time. Like I told you before, you need to try to focus how you're gonna tell children, tell people how to move in around 10 minutes during the morning, 10 minutes, maybe in the evening, and 10 minutes at night. So the more you accumulate, the better it's gonna be. Intensity, moderate enough to cause increase at the heartbeat and respiratory system. So that's what we want. Time, total 30 to 60 minutes per day, depending on the goals. But our goals right now is for them to have boost of movement every day, the whole day. So the type, all kind of activity, it doesn't matter. It can be from all sorts to weight training, okay? So the important thing that you have enjoyment, you enjoy, you have pleasure, that the programs and activities that you do match with the personality, match with your clients. So it doesn't matter if it's gardening, dance, jumping rope, bicycle, but the thing is keep on moving. ACSM has published a call to action addressing COVID-19, and they have given us some guidelines about it. So what they want is that when we return from this quarantine, is that the sports and physical activity have focused on high-level athletes. This statement addressed gaps for the average healthy person to return to physical activity following a period of inactivity. So we need to be very careful when we come back because they were being very sedentary and they haven't been moving. So statements combine research evidence and experts' opinion to bring attention to a current scientific or clinical need. So the short and long-term impact of inactivity negatively influence physical and mental health. So physical activity is critical to health outcomes and an essential component of weathering the pandemic. William O. Roberts. The effects of exercise on the immune system are well documented, and a thoughtful approach to return to sports and physical activity after a period of inactivity is critical. So telehealth should be considered as a way to reach patients and consult them regarding the importance of physical activity during this pandemic. So here is the 12 actions that we need to take. Number one, well, individuals should start or continue moderate physical activity for 150 to 300 minutes a week. For children from 3 to 5 years old, they are supposed to move around 300 minutes, and that's the less that they need to move. So how we're gonna do that? That's a big question. That's the challenge that we need to take. How we're gonna make our children to move more than 300 minutes a week. So individuals who had COVID-19 should consult with a primary care physician to determine a safe return to exercise. Exercise at home or outside while maintaining proper physical distance from others and using face covering when needed to minimize droplet spread. We need to have a little bit of we have a little bit of concern with the covering and doing some exercise, because if it gets wet, you can breathe good. So we need to take this consideration, maintain a fair distance, so you don't really need to be wearing the mask. But if you are around a lot of people, you need to wear a mask. So there is a balance that we need to take. Maintaining immune health by participating in 150 to 300 minutes of moderate to vigorous physical activity a week and keeping body weight at recommended levels. And it's very moderate, I need to say. High-risk individuals should refrain from exhaustive exercise, overreaching, and overtraining. Determine evidence-based recommendation for return exercise after resolution of COVID-19. In the interim, advise rest and no exercise for 2 weeks after resolution of mild or moderate COVID-19 or from a positive test, followed by slowly resuming physical activity under close monitoring by healthcare team. Apply and adapt the World Health Organization interim guidelines, COVID-19 mitigation, checklist, and risk assessment toolkit to each sport discipline. Use innovative strategies inappropriate to promote physical activity during COVID-19. The other ones are develop policies to safely reintroduce group activities that augment physical and mental health in close considering of social determinants of health. Optimize sports medicine, telehealth to reach across diverse population. So like I was saying, maybe not everybody has the opportunity to have a platform, have a Wi-Fi, but you can use instead other tools in your community. You can reach out around with radio station, you can reach out with television. So ensure equal access to telehealth across all countries. Vulnerable population, the economically disadvantaged, and those with language barriers. Implement the use of masking and testing to reduce spread and avoid close contact when masking fails. When universal masking cannot occur, high intensity exercise competition, diagnostic testing, and effective contract tracing protocols become increasingly important, especially in high contact risk sports. This is very important. So regular exercise improves physical and mental health and is safe when it's physically distant, especially outdoors. Moderate exercise improves your immune function and may be a factor in reducing your risk of contracting COVID-19. When others are around, masking may be the difference between staying healthy and getting sick. Remember the 4 Ds for exercise around others during pandemic. Double the distance and don't draft. You need to have some space. If you are running, don't be one instead of behind the other. You need to be like, not be aligned, okay? You need to be on the side, and you need to at least be 12 feet wide apart. So in general recommendations, 150 minutes of moderate activity, 75 minutes of vigorous activity, but in this time, moderate is better, and 300 minutes of moderate activity for children a day. At least, if we are talking on steps, the more we move, the better. Here is saying that children should step 12,500 and adults 7,500. So I would say move more and stay less sitting. So here are the effects of physical activity on your immune system. And I will want to say that if you're moving, at least moderate, exercise can improve immune functions. Immune function is greater in elderly that are conditioned versus sedentary. So exercise reduces risk and severity of respiratory infections. So being moderately active reduces likelihood of upper respiratory tract infections, and acute moderate exercise stresses the immune system less than prolonged high intensity session. So in this part, we want to maintain moderate intensity. So here are the benefits on bone health. The exercise rebuilds bones and prevents thinning by stretching and straining them, improve the flow of nutrients to the bones. It prevents osteoporosis and serves as a treatment against it. But here, what we need to do for the bones to be better is to strength training. We need to incorporate strength training so our bones get healthier. Bones respond to exercise by becoming thicker, stronger, and more flexible, prevents fractures, stimulates bone tissue formation, increase ligaments and tendon resistance. Walking is also quite improved by the activity of and exercise of strength training. Here are some effects that we can have during the quarantine if we are doing no exercise or physical activity. So we have some muscle loss quickly detected within 2 days due to inactivity. It is prone to the degeneration of the fibers, explained mainly by the suppression of the synthesis of muscle proteins. It affects glucose homeostasis, reduce insulin sensitivity. Aerobic power is damaged at all oxygen acquisition levels. Energy imbalance during physical inactivity is associated with fat buildup and is found in system inflammation. Next, Luisa. So here is some effects that it was found at Brazil of 1 month of quarantine, and it was on mental health of the Brasileiro. So they found that acute anxiety increased 40%, stress increased 71%, depression increased 90%. So we need to be being more active. So before we start some exercise during this quarantine, we need to take some maybe a questionnaire. Here is some pre-exercise screening questionnaire where you can see if you can start exercise right now during this pandemic. And there is a few questions that you need to ask or you need to answer to know if you are okay to do it. It's almost like the PARQ questionnaire. I think you know all about the PARQ questionnaire. So barely there are 7 of those. So these questions are, do you feel a sore throat? Do you feel cough and sputum production? Do you feel fatigue, or do you feel short of breath or difficult breathing? Do you feel fever over 37.8? Have you had fever before more than 3 days? And have you had any contact with anyone who has been diagnosed or suspect of the new coronavirus? So if the answer of any of these is yes, you need to go to your doctor and see if you are okay to start moving. But before we move with Luisa, I'm gonna ask for something for everybody that is right here, right now. We are here because we are talking about physical activity and we need to move more. So we have been here more than an hour sitting down. So I'm gonna ask you to stand up, have your legs open wide as your shoulders, and you're gonna do 10 squats. So you need to keep on moving. So let's do it. Are you ready? Let's go. And 1, 2, 3, 4, 5, 6, 7, 8, 9, until inhale, exhale, and that's it. You are moving.
Thank you, Melissa. So general misconceptions of physical activity. Number 1, I need equipment in order to exercise. Well, Melissa just proved right now we don't, right? We do not need equipment. It is great to have equipment, but we don't need it to be physically active. And we even though we love to have facilities and they're wonderful, we don't need facilities. Many times we allow this situation to isolate ourselves. And as already has been explained, that isolation, that being sedentary, impacts not only our mental health, but it has detrimental effects on our cardiovascular, detrimental effects on our bone health. And it kind of creates a chain reaction to where we are less ready, less prepared to combat any illness that comes. So let's take that misconception out. And just like Melissa explained right now, every hour, do something quickly, stand up and get moving. Now, I would like everyone, wherever you are, say this out loud. The solution is in the problem. Remember, Melissa said 2 things, attitude and behavior, right? Let's change first our attitude. And our attitude is, so the solution is in the problem. We are faced with a problem, but now we're changing our attitudes. And we are the perfect professionals to do that. Because after all, we are the professionals of movement. We are the professionals of physical activity. We are prevention. How empowering is that? What better place to be than to be the professionals, the agents of prevention? So our new statement is the solution is in the problem. So we have changed our attitude, right? Because now we are agents of solutions. We're changing our narrative, and our behavior as a consequence now is going to change. We are physical educators. We are coaches. We are professionals of physical activity. And our number one job is to get our population, our society moving within a healthy, being cautious, right? Maintaining our distance, our coverings when it's necessary. But our role right now is at the forefront. Just like nurses and doctors are at the hospitals, we are at the forefront of society. Our children, small children, they learn by playing. We cannot take away their playing because we are negatively impacting their learning. So it is our job, and we need to put ourselves with the attitude of empowerment. What can I do, and how can I make it fun? How can I motivate my athletes, my students to move? I remember in March when we all went online and we had to teach online, and most of our class time at first was simply motivating. Guys, we're gonna get through this. This will pass, we will adapt, and we will move forward. And that has to go hand in hand with the exercise. Motivate, exercise, motivate, exercise. Our activities have to change. Remember, not everybody will have equipment at home. So our equipment becomes what is around us. The solution is in the problem. We are home. At home, we have, how many of you have cans of beans or cans of vegetables? Those can be our weights. Do you have a pack of rice? Those are heavy. Those can be our weights for resistance. Our chairs, even our beds. We need to use live interactions. We are in an online setting, but it does not have to be isolating. We have to make sure that the online factor engages our population and it does not isolate them further. Also, we need to have goals, and Dr. Shakar Dutt said this. We need to have goals. When we have goals, we are working towards something. So whether you are working with athletes, whether you are working with simply students, or on the recreational side, let's establish goals. What do you want to achieve in a month? Well, let's go for it. And I do this with my students. I make them have a pre, a mid, and a post. And to motivate them, I give them points in class for doing the pre, mid, and post. If you have a goal, a written goal, they are more likely to participate. And when we start moving, we are happier people and we are healthier people. We're gonna have to adapt our exercise. What do they have at home? What do we have around us? And let's use that. Keeping track of progress. Our population, our society has enough stressors. I remember a student sharing with me that her small sister, here in Puerto Rico at 10 o'clock, we have an alarm that goes off in everyone's cell phone. And that means quarantine everybody home. So whenever the alarm goes off on her phone, she gets scared because in her mind, the virus is coming. Misconceptions. The virus is coming. We got to hide at home. So my challenge to her was, let's change the narrative because we are stressing her out, and that is not healthy. Let's change the narrative. The alarm went off. How much exercise have we done? How many games have we played? Let's get creative within the home. Those of you that have small children at home, your child can be your weight. Your child must be a participant. Children are aware that something is going on. I have small children. They are very aware something is going on and it stresses them out. So it's important that in every session, we have a moment of mindfulness. We have a moment of relaxation. Number one, it's necessary for our mental health, and it has an impact on our physical health. But also, it brings things to the center, brings peace, brings relaxation, and now we have a clear mind. Our students, we are able to engage them. It's important that even though we're online, we call them by name. We ask them about our goals and that they are present in what is going on. It is also important to remember that as physical professionals, as physical activity professionals, we have to partner with community leaders. And I want to share something that I was a part of that was really positive. Some of the families that I work with an organization are low socioeconomic. So they were very limited as to what they had at home. So what we did was we established pickup stations with packets, simple things, balls, jump ropes, simple things. And they would just drive by and pick up their packet. And in their little packet, they had basic materials, inexpensive materials. They also have an instruction on how parents can play with their kids. This not only brings the family together, but it brings anxiety down, stressors down, and our children are getting physical activity. The parent is getting physical activity. So now the environment within the home is more positive. We even went as far in some cases to prepare small clips. How do we play with our children and how this is positively impacting, influencing their development? We have to be advocates. Physical activity professionals, you are at the forefront. Our narrative has to be positive. Our narrative has to be of action. We cannot stay passive. We cannot stay sedentary. Prevention is the key. And prevention is in exercise. The solution is in the problem. Exercise is part of the solution. And with this, I conclude our presentation. I was reading in our question and answer. One of the questions that was asked was, what can I do to stay healthy?
Luisa, could we'll take the questions later. Do you have any questions in which you think they could answer? Could you put that first? I said, could you put it?
Yes. True or false? Because I am home, I cannot be active. Is that true or is that false?
Participants, please you put the answer on your chat box, please. All the participants, you are, yeah. Luisa's putting, okay, you're getting the answer. A number of them saying it's false. Yeah, most of them saying it's false.
Yay. Yes, that is false. Absolutely false. We need to be creative and at home, make it work. Next question. 10 minutes of physical activity does nothing for my well-being. True or false? 10 minutes of physical activity does nothing. Might as well don't do it.
A number of them with false, some with true.
Remember Melissa, she just stood up and did 10 squats, yes. Right?
Yes.
Melissa,
true. There are some saying true. Some saying it's false.
No, guys, remember, 10 minutes of physical activity, I'll take it. Do it. Do it. Between one task and another, walk up and down the steps. Do your squats. Hold your kid. Put your kid on your legs. Lift your legs. Run in place. Jump rope. 10 minutes. You cannot do 60 minutes. That's okay. Do 10 minutes. 10 minutes is good.
Yes, you can accumulate them during the day. It doesn't say that only do 10 minutes. What we are saying that you need to do 10 minutes in the morning, maybe 10 minutes at lunch, 10 minutes at the evening, 10 minutes at night. So you accumulate already 30 minutes of exercise. The more you do, the better. Right now we have a problem that we are sedentary, like I was saying. And maybe you're saying, oh, but I do 60 minutes of exercise like in one day. But how much time are you sitting down? That's the question. Because maybe you are doing 60 minutes, but you are sitting more than that. So you are a sedentary person. So we need to, yes.
Melissa, on your behalf, Melissa's question is, in a day, how many hours do you sit down? Please do put your answers on the chat box. In an average day, how many hours during this COVID you sit? Can you kindly put it on your chat box? Yes, 4 hours, 1 hour. We are getting answers. A maximum 6 to 7 hours you're sitting, 2 hours, 5 hours, 8 to 10 hours, 8 hours, 6 hours, more than 10 hours, 8 hours, 5 hours, 6 hours, 20 hours, 3 hours. Oh my God. So that's something very interesting, which is to see this. So Melissa, I think I'm reading it out for you. Almost half the day they sit, 2 hours, 8 to 10 hours is on average, 12 hours, 22 hours, 5 hours, 3 hours. They happen to sit in a day. 5 hours. I think it's amazing. This answer was something which you saw. Thank you for putting up this question too. Yeah.
So set goals. You already estimate, right, roughly how long are you sitting down. So now set goals. I want to sit down less. I want to move more. And guys, write it down, because if we don't write it, we forget. So write down, my goal is to move at least 5 times a day for 15 minutes. And next week, change it. I want to move 3 times a day now for 20 minutes. Change it up, but write it down, set goals.
Yes, I hope you have understood this. Ma'am Luisa said, can you write it down? Like, what are the goals that you happen to set for you? Please to write in. You could go maybe with what you set a short-term goal, at least initially. Maybe you say 5 minutes or 10 minutes, you're going to start moving. So please to put in, ma'am, I'm continuously moving, doing my household works, it's enough. We are getting answers. Yes, participants, please. What are the goals that you intend to set right now? For those who are sitting for more hours, 10 minutes, I'm going to keep walking, starting cardio 1 hour daily, 30 minutes of walking, increase flexibility, start 30 minutes a day, 1 hour morning walk. I'm going to get up early. I'm going to help my dad to go, 1 hour of walking, 20 minutes of physical activity 3 times a day, and 1 hour of walk, 1 hour plank exercises. I'll try to move more of cardio and walking yoga, and 1 hour morning walk, 30 minutes, 1 hour yoga. I think it's a good goal they happen to set.
So right now, what is happening is our attitude is changing. That is what is happening. Our attitude is like, wait a second, I can do this. Absolutely. Our attitude is changing. We're going to do this, and you're going to see how you're going to feel better. And the better you feel, the more you want to do it. So we are changing our lifestyle. It starts with an attitude change. Excellent. I'm happy. I'm excited about this.
Thanks, Luisa and Melissa. Over to Dr. Sanjay Prajapati for the questions, please. Ma'am, can you stop sharing the slide, sharing the screen? Yeah, thanks. Dr. Sanjay.
Thank you, ma'am. Thank you so much. First of all, I would like to say the session was wonderful. I would take a question. There is 2 questions. One, that is, does exercise help in fighting COVID? Another question, what is the effect of exercise on immune system? So as we know, if we increase the immune system, so we can fight with the COVID. So can you just brief it? Does exercise help in immune system or with the fighting with the COVID?
Or do you want me?
Unmute. Yeah. Yeah.
Okay, so the immune system, it gets healthier, but we need to do some exercise on moderate intensity. If we do too intense, maybe our immune system is gonna go a little bit low. So we don't want that right now. What we want is that immune system, it gets stronger. So we need to eat healthier, stay moving, stay fit, and moderate intense level. So everything, our system, it's working in the right way. We want our cellular T to be active.
Okay. Luisa, you want to reply?
To that, I will simply say increase your water intake.
Okay.
That's it.
Also the water and also sleep.
It is,
You need to rest.
I asked my students about their sleep just yesterday. It was crazy. They were going to sleep at 4 in the morning, waking up at 7, watching a show, going back to sleep, waking up at 10 to take a class. No, 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 no. A healthy, good sleep is so important. So one of the goals I set for them is to go to sleep, do not wake up to watch a show on TV and then go back to sleep. Stay asleep and form a routine.
Yeah, thank you. Another question, what type of exercise would you like to prefer to 50 years old people? What type of exercise, like vigorous, moderate, what type of exercise you want to prefer?
With the elderly, I'll take it first and then Melissa. With elderly, we need to be careful of what conditions they have, but it is important that they move. The more still, the more rigid their muscles get. So it is important, even if it's stretching, walking out to the courtyard and coming back, depending on their ability and their agility, it is so important that they move around for their circulation. Simple things like that will make a big difference. Melissa?
Yes, also the respiratory system, they need to do some exercise for breathing. They can even inflate globes, they can just exhale and do some yoga. Strength training is good. Pilates, yoga, things that they can do with their own weight. Of course, they need to know like what kind of chronic disease they have and what they can do, what they shouldn't. But physical activity is good for everybody. It's just the intensity and how much. So I think you can do it in moderate intensity, low impact to keep on moving and just be like that.
Thank you, ma'am. One question is asked by darling Luca, ma'am. I hope so. It is this question only. How can we get attitude to change to belief? It is part of my lifestyle and part of my being.
Can you repeat the question?
How can we get attitude to change to belief? It is a part of life or part of my being.
I think by practice, you practice what you teach. We can verbally communicate, but when you just live a style that is healthy, live what you preach, I guess, it communicates that message, and then it shows others that they too can do it, and how good it feels and how good it looks. Did I answer the question sufficiently?
Yeah, thank you. I think belief system is something that related, like if you have headache, okay, so instead of taking a tablet, if you have belief on a glass of water, so if you take glass of water, your headache will be, I think you will not feel headache if you have belief on the glass of water. So I think this is, so thank you so much. Over to Dr. Usha Isnai, ma'am.
Thank you, Dr. Sanjay. Thank you. We'll take our remarks from our panelists. I think we'll have our remarks from our panelist. Shekhar Datsa is there. Shekhar Datsa. Can you see, sir? Okay, Rosa, Professor Rosa, for your remarks.
Yes. Okay, I just would like to mention that Darlene is on, but she's not visible. Sanjay, please, if you could
I'll get Darlene.
check that.
Yeah.
Okay, great.
Darlene, can you hear us? Darlene, can you hear us?
No, I think madam had left.
Okay.
I mean, she's online.
Let me check, ma'am. Let me check.
In the
Yes.
meantime, can you take up?
Okay. Yes. Well, thank you very much, Luisa and Melissa. I'm so glad for your presentation. You gave the theoretical framework, and then you went to the practical part, which is so important, and a reminder to all of us who preach and work in the area of physical education, how we can support. Because one of the things that you mentioned, particularly Luisa, is like sometimes, I mean, this is our area, but we don't practice, okay? This is a reality. Like routine takes us to a moment in which we talk about this, that's the theory, but we don't practice. So how to implement that? And the exercises and the ideas you provided are so simple. And then in a way that there is no excuse. I mean, it's just a reminder that will make us feel healthier and feel better. So this is wonderful. And I also enjoy so much the idea of how to embrace and not to forget the kids who are at home, because they feel and they know that there is a strange atmosphere. So how to embrace them and to make them feel better. And that's fantastic. So thank you very much for the way you approach this presentation, because it was indeed very, very interesting. Now, there's one question there that I would like you to answer. Maybe it's Melissa and Luisa, I don't know who of you. And it is, what about if I do my homework activities? I mean, my housewife activity. Is that, I mean, I'm doing physical activity? That was one of the questions. So your reply, it's important for them, because we know that that's part of women. Most of the time women's, it should be share work, men and women at home, but sometimes people believe just by doing the activity at home it's enough, I am active. So how would you react towards that?
I can definitely identify as a mom with that question. And here is an important component of exercise that we cannot forget. Exercise is for my well-being. When I'm doing chores or my work at home, the mentality is I need to do this, my responsibility. But I also need to take time to maybe then relax, meditate, do a yoga that is for me. And if I am not able to do it just for me, I have to include my child because it's just me and my child, then do it to where it's you and your child, but the mentality, the attitude cannot be that it's a job or a homework. It has to be of this is for me, beneficial for me personally. Melissa, if you want to add something.
Yes, those are activities of daily life. And by staying active and doing exercise, it's going to help you to stay better, feel better, stronger, with more energy. So you need to at least continue 10 minutes, 15 minutes. It's not boost like 1 minute swapping, 1 minute doing my dishes, washes. So it's a little bit more of that. You're active, but you need to do at least 10 minutes continue movement.
And I call this too a little bit of self-love. That physical activity was a job, it was a chore, but now I need my self-love. This is my exercise time for me, whether it be meditating, whether it be yoga, whether it be stretching, whether it be a fitness routine, it doesn't matter, but this is my me time.
Exactly, and it is so important, and we can connect this time with Marisa. Is another person, Maria Luisa from Philippines, who she is a psychologist, and he said, you don't need to feel selfish. But if you think about yourself, we need to feel quite well. We need to feel peace, We need to feel in a way that we are complete. And in that way, we can serve better. So if we do our physical exercise, which is not a lot, I mean, we just indicated you can do 10 minutes here, 10 minutes here. When Melissa said, let's do the squat, I was doing my squat as well, because we keep on sitting down all the time. So that's really good. Thank you very much for your presentation. If by the end there's time for another question, I will. Okay, but let's leave some time for my friends, panelists. Thank you. I enjoy.
Thank you, Rosa. Darling Kluka?
A wonderful presentation to get all of us to think about what we do daily to make a difference in the world. I have to always remind myself, because I have not gone from an attitude to a belief. And you know how the airplane people say, put your mask on first and then help others. So I think about myself putting my mask on first to then be able to help others. That said, your outlook is when it's what you perceive to be a bad situation, like the COVID, instead of saying to yourself, I cannot do this, I cannot do that, I cannot whatever, I need to really stop and ask myself, I do this many times a day, what can I do? You know, what can I do? And then we look for ways that we can continue to do. So that small mind change at that moment gives us extra energy to be able to choose something that allows us to include this in our lives. I was really excited about hearing all of you talk about the quality of life with the social, intellectual, emotional, and so forth. And it's almost like, you know, the old saying, you have a glass and it's half with something in it. Is it half full or is it half empty? And again, sometimes when we get into these, what we think is a terrible situation, we look at it critically to see it's half full, half empty. And we need to be thinking now, especially, how can I make lemonade out of lemons, you know? So I sincerely appreciate all of the conversation with this, because Beatrice can be in Brazil and understand and do these things, and you can be in Puerto Rico and have a marvelous experience as well. So Rosa, thank you for your comments too.
Thank you, Darlene. It was wonderful hearing you. Yesterday we missed you out, but we called you, we couldn't get you. And yeah, Beatrice, Professor Beatrice, for your remarks, please.
Well, thank you for the presentation, and I enjoyed very much. I closed the video, but I was doing some exercise. I was moving, I was not sitting.
That was great.
I would like to remark that Shekhar, and he said that how important it is to have a very good physical education, good training, and a good sports science. And your presentations, Melissa and Luisa, were great, were based on sports science. I mean, how we improve the science to let us know what we should do. Something was natural for us, moving, doing a physical activity, but now you have this basic, the physiology, the psychology, the social science, all of the science to help us to understand our movements and how important it is for us. And now the motivation is not motivated for ourselves, but to all of people around us. And I like very much the expression that we need to keep our society moving. Yes, for sure. If you are in physical education and sport, we need to move our society, not only us. Sometimes it's difficult only us, but we needed to have these goals that you said, to motivate it and also to follow the World Health Organizations. They have all these protocols to help us to see how much you should reach 150 minutes a week or less or more. And then we needed to follow because there are so many people like you studying this physiology and the psychology and the social science to base us, to keep moving us. Okay, thank you very much, Melissa and Luisa. You have a very good work and great presentations. Thank you very much.
Thank you, Beatrice, for being a part of this session. Rosa, I think you had a question. Rosa, I think you said
Yes.
Yeah,
Yes.
Yeah, you can have a question.
Yes. Yes, it's a challenging one that it's in there in the chat box, and it is related with why some elite sport athletes, in spite of the fact that they are fit and everything, why they get sick with COVID-19. This is a challenging question. I mean, I have an answer, but I will give you the platform for you to answer, because I do believe, I mean, there are certain elements that affect, but please.
Well, if we go into the social and I guess psychological aspect, and this is not, I didn't fill out questionnaires of these athletes. This is my perception. There could be a factor of feeling like this will not affect me because I am so fit. I am, you know, I have a very strong body. I'm a healthy person. So this is not going to affect me. And then we get careless with the safety measures that we are supposed to adhere to. So, you know, we come in close proximity, we do not wear the coverings because there is the perception that, you know, I am such a strong, fit person that will not affect me. So I think that is one of the factors that could be the cause. Melissa?
Yes, I agree with you, Luisa. Yes, we are a little bit stronger, but we are not immortal. So we can be, if we don't take the measurements of washing our hands, keeping the distance, we can get the virus. So I agree with you, Luisa.
Exercise does not mean that you're not going to get it. It strengthens your immunity. It strengthens your system to be in a better position, less likely be able to combat if you do. But if I'm not wearing my basic protection, if I'm not being conscious, if I am, you know, being too social and getting close and working out, and there are cases, I'm not going to mention athletes' names, but there are famous athletes who were seen at the gym with a bunch of other people working out.
And they get it.
And we know fitness facilities are incredible breeders for infections and bacteria. You know, so that was probably preventable.
Yes, even
Yes,
with a good nutrition. Yeah, even with a good nutrition, it's gonna help us, but it doesn't mean that we are not gonna get it.
Exactly. I believe that, I mean, there are two issues, which is what we eat, okay? Sometimes there is a saying, what we eat says what we are. So this is so important, how to keep healthy. Now, the other aspect I feel is mental health, because actually there are many things that happens in our mind, and mind controls. So if we're weak in our mind, then of course it will affect the whole body. Okay, so that's it. There is a need, and for me, when I have seen different experience from many places and different realities, well, I observe that definitely when someone sometimes get affected and the immune system goes down, when mentally you're really not so strong. So that's one moment. And there is another one, which is a continuous debate between those who are advocate to physical activity, and it is that not necessarily being high elite athlete is healthy. High performance or high elite sport is not healthy. Physical activity and to be disciplined with doing it's easier or it is healthy. When we preach about why the importance of doing physical activity, regular physical activity, to be in a better shape and a better attitude towards life. Thank you.
Thank you, Professor Rosa. I think I could also add a bit to it, as along with what Luisa and Melissa mentioned and Rosa, was many of them, even once they get any little bit of maybe fever symptoms, we tend to ignore. We don't listen to the body signals, thinking that nothing is going to happen. That's could be another thing where they tend to ignore. Could also be another reason, because if nothing is going to happen to us, so ignoring of the symptoms that is there and saying that this will get over could also be another issue. That's just my suggestion. Kishore sir, remarks from you, sir.
Yeah, thank you, Dr. Shah, and it was very informative. As I have in my initial introductory address, as I told, it was the same thing. It was very, very informative, very mind-boggling. Like many of the things like which have been told that even 10 minutes of exercise is something which contributes. This was something remarkable because everyone need to keep in mind. Many of the time, what happens is that contemporary sessions are looked after either in the morning or in the evening. Then we look for a half an hour to 1 hour sessions, and the small time which we get normally we ignore. But I think what both the has been rightly pointed out by Dr. Lucia and Dr. Melissa is absolutely right that you can even 5 minutes, 10 minutes you get in between gap, you can utilize it productively. And this 300 minutes with this moderate exercise which is required per week, that is something also informative. They can do it in different spells and maybe in days together, some days 30 minutes, some days 40 minutes, so that altogether they can consolidate to 300 minutes. That is what, and also about the mental health, keeping the children, the family together, along with the parents, the children, they all meditating, involving in meditation, keeping the child together and doing the exercise, because the fear or whatever anxiety, stress which the children have can be minimized and they can be brought, they can also be brought to good mental health. That is also remarkable. That's also very important. What I would like to, put forth is something which is concerning me and also the elite sports person, because Dr. Usha also sometimes keep warning me that you should not do high intensity exercises, because we are prone to doing high intensity exercise, not moderate. And because you have been always pointing out about moderate exercise, will the high intensity exercise affect the immunity adversely? And if so, then elite sports person who are training need to be, whether we need to be cautioned on that, because immediately after high level, high intensity workout, there can be a possible immunity, the immunity level can come down. So whether those sports persons who are doing high intensity workouts need to be alerted and said that, you at this point of time don't do that much. And that is one thing. And the second is about what Professor Rosam has pointed out about the diet part. So at this point of time, you don't get that much of diet as formally available. One need to have a nutritious diet, having different components of, protein, carbohydrate, other nutrients, fat, and vitamins. So in a point of time of pandemic, we have to have a few items, which we can get available, whatever is available from the nearby sources. So would you like to throw some light on any precautions to be taken for the diet? And also that is about the nutritional part and also about the high intensity workout. Any comments which you would like to make? Thank you so much. Thank you.
Luisa? Luisa, can you hear us?
Here we go.
Luisa, yeah. You heard the question? Yeah.
I'm having trouble hearing.
I'll tell you the question was, so was asked the first question, high intensity exercise, does it in any way affect the, will the immunity decrease? And then what is going to happen to the elite athletes once they come in for training? So do you have any suggestions in that? That's the first question. Then I'll tell you the second question later.
Most elite athletes have been doing some kind of modified training within their homes, online, and virtual. However, when it is transitioned to how it was typically done before, I'm not sure what modifications they're going to do, but I am sure modifications are going to happen. And this is something that needed to happen even before this whole COVID. So I think these modifications were a long time coming. These should have happened. I'm not sure if this is directly related to the question, but right now in the US, there is a debate, I guess, because some athletes are not wanting to participate in the way team owners and administrators want them to participate. So there's kind of been a disagreement with how this should move forward. Did I answer your question?
The question was,
Also,
does high intensity training, does it have any effect on the immunity system? High intensity, Melissa.
Yeah.
well,
Yeah, Melissa.
okay, I will say that we need to see like individuals, like what we were doing, what we're like, where they are standing. And what we are saying is that if you are in quarantine and you are not moving, better is to maintain a moderate exercise. If we speaking of athletes, of elite, maybe they are keeping moving, they are keeping working, but if not, they need to come up with progressions. We need to start with the good progressions on intensity until they get into the optimal level. So we know that when we start exercise and we don't really do it, our immune system starts to go down a little bit for a few weeks, but then boost up fast. So the thing is that maybe they are not working out, they are not doing any exercise. So we need to do it with progressions until they get in the high level again. But it's not, I'm not saying that high intensity is bad. It's just, I'm saying that when we are at rest and we start moving again, we need to do it moderate and then go again to a high intensity.
If I might help a little bit, in the US right now, we have professional teams, and basketball particularly has gone to what's called a bubble approach, where they all stay and they all eat, drink, sleep, practice, play, whatever. It seems as though, because none of us really know, Dr. Couture, none of us really know the effect that a better equipped immune system will avoid the virus. But as long as they are testing negative for the COVID virus, it seems as though they have, because they've created an environment that is limiting the virus, that they can continue to perform at high intensity levels and practice in that way. there has not been, in my humble opinion, worldwide, any information that's of worth anything for those that are on the extremes of the bell curve. We're very concerned with the general population here and the death rate, but those who are really in bad shape or those who are really in good shape, we're just not sure yet what needs to happen. So my prayer, because I have no control, but my prayer is that the people who are looking at those elites are doing the kinds of testing and assessing and evaluations that will give us some more concrete guidelines. We have, I think Luisa and Melissa may know, there's a man by the name of Chris Cuomo who is on our ABC television. And he is a very fit, weight training individual. He got the virus. He was knocked on his rear end, if you will, for months. And so even though his fitness level was outstanding, he still got the COVID virus, and he then fortunately recuperated. We don't have enough information on that now with these athletes who are getting COVID virus. So we need to watch that. So I wish collectively we had a real answer for that, but I'm really not sure we do yet. But it was a wonderful question and must be asked.
Thank you so much. Thank you, everybody, because it was something which is quite concerning all of us, and especially the elite sports persons. And many of the times this question is often being contradicted most. And in my case, even Dr. Usha personally warned me not to do high intensity workouts because I am keen in doing high intensity heavy workouts. So he is telling not to do that.
Dr. Kishore, sir, he gets to in high intensity almost for 2 hours. Dr. Victor, so the research clearly proves that the immunity tends to decline. I'm not talking about the elite athletes, but he has a very high intensity workout throughout. So that's what he does every day, 2 hours. It's a very high intensity work. So I'll show him the research, and then maybe so would be valid with that, because when Dr. Victor, who took on the session, also did mention, but we do have research from general. I'm not talking of the elite athletes. But he continues, because the person who continues, a fitness freak who does it for maybe, I think even including Kluka, and as Dr. Yuri was telling you, take on the cycle and you make it a point of being fit. Thank you, Kishore, sir.
Thank you, ma'am.
Sanjay, so on behalf of the Ministry of Youth Affairs and Sports, I'd like to thank Dr. Luisa Velez. It was such an energetic, and I think you're bubbling with energy. Your emotions, and I think the entire participants got energized. Earlier we had Sarah, but it was indeed very fortunate to listen to you. But I thought you're going to give us something on sedentariness, because we look forward to some sort of a work that is possible. Another question coming in is children in the school sit for hours together. People sit in the office for hours together. But I was told in Finland, we have 1 or 2 schools where they have standing schools, where the children, they don't have chairs to sit. So thank you so much, Professor Dr. Luisa Velez, for this very interesting, informative, and the topic which is the need of the hour, because it's going to change the entire scenario. COVID is going to change the entire scenario of sports, not only sport, the entire living in the country. And on behalf of the Ministry of Youth Affairs and Sports, Government of India, Hello India, a big thank you for this wonderful session that you gave us, and you yourself saw the interaction that you had with the participants. But at the outset, I'd like to thank our guest of honor, which is in his absence, Shekhar Dutt sir, who was the former governor of Chhattisgarh, and also the former Director General of Sports Authority of India, who brought in sports science to this Sports Authority of India. So I think it's because of him that we have the sports science sections coming in. On behalf of the Ministry of Youth Affairs and Sports, Government of India, Hello India, thank you so much, sir. Hats off to you, because you spared your valuable time and you were with us. I'd like to thank Melissa. Melissa, it is so wonderful because you made us move, and I too did the spot. So I think every time you get up, and I was so happy to hear Beatrice doing putting up this, and many of them are doing squat. And I think there's some still continuing to do the squat. Melissa, thank you so much. And for the information of Kishore sir, Melissa is a member in the Department of Sports and Recreation of Puerto Rico, and a very big organization like Sports Authority of India. So I think, Melissa, we look forward to collaboration from you. We would like to have some projects you could guide us so that we could start something in the country. Thank you so much for your valuable presence and getting us moving. Like Luisa said, there are a lot of things like the solution in the problem you have made as agency for prevention. So Dr. Luisa, I think you have given us certain slogans. The agency for prevention and problems that we've been talking about, that's been great. I think it's been made a mark. I'd like to thank Professor Rosa D. Amico, who's the president of IPASCWay. Every time you come up with a lot of things which are so innovative, and you fill in the gaps. I don't know from where you find certain gaps from here and there, you bring it in, and that's so meaningful. Thank you so much for making this webinar so interesting, because most of the international speakers were highly appreciative of the panelists. That's one response feedback which we got. They were highly appreciative of the kind of questions that they put forth, and they all are eagerly looking forward to more sessions. Thank you so much, Professor Rosa. And Dr. Darlene, I always said the light has come in. We missed you so much for the past 2-3 days. For the information of the panelists, not the panelists, for my participants, Rosa has a real problem, but she has hit the problem. And I can tell you the pain goes away. With all the pain and aches, especially sitting here, I really need to thank you, because we keep praying for you. And I'm sure as long as the seminar session was on, there wasn't any pains as such. So thank you so much for being a part of us and motivating us and being a part of the session. I'd like to thank Beatrice. Thank you so much. It was so nice. Hope you're with us now, because you did enough of exercise today, switching off from the videos and doing a lot of squats. So thank you so much, Beatrice, for your valuable presence. And I'd like to thank Dr. Ajit Kishore, Principal Sir. As there is a fitness week, he makes it a point, maybe 3 hours, 4 hours, rest is gone. But for him, the most prime is fitness. And wherever he goes, he makes it a point of spreading this. And that's why I think we have a very good center. So when you visit our center, you'll come to know how things go on. Thank you so much. And he makes it a point of getting all the other people fit. So that's so sedentariness, I think it starts from here. We also are thinking of starting a concept of minimizing sedentariness in our setup. So on behalf of the Ministry of Youth Affairs and Sports, Kishore sir, thank you so much for being so supportive and giving us the right kind of a direction. I'd like to thank Dr. Sanjay Prajapati, who's being the co-host with the questions that happened to us. Sanjay, thank you. I'd like to thank Dr. Sanjeev Patil, because he's been working day and night behind the screen, and especially getting in flyers. Sanjeev Patil sir, thank you so much. I'd like to thank Pranesh, Hari for their technical support they've been doing. And my dear PE teachers, it was amazing, because you participated so actively, and we saw, and I'm sure you all have set goals, because I think you're going to walk half an hour or 10 minutes, you're going to bring in, and you are the ambassadors, the power for change, and you're going to prove it. So once again, on behalf of everybody present here, thank you, namaste, and we'll have a high five later, but we have a feedback. So for Luisa and Melissa, we have a feedback form.